Fiona Apple once said, "When you're surrounded by all these people, it can be lonelier than when you're by yourself. You can be in a huge crowd, but if you don't feel like you're comfortable, or if you don't feel like you can trust anyone or talk to anyone, you can feel like you're really alone." Here's some fast facts about depression. It's most common among women. More than 20 million people in the U.S. will suffer from depression in a given year, and 1 in 4 Americans will experience depression at some point in their life, and President Abraham Lincoln suffered from chronic depression his entire life. I have family members and friends who have suffered from depression, and I even did myself a couple years ago. As my fast facts have told you, 1 in 4 Americans will suffer from depression in their lifetime, so it's important to be informed on the information and the symptoms and treatments just in case it would be needed. Today I'm going to explain to you everything there is to know about depression, including the types, the causes, the risk factors, the symptoms, the diagnosis, and the treatment. What is depression? Depression is a mental health disorder, and it's a state of low mood and aversion to activity that can affect a person's thoughts, behaviors, feelings, and sense of well-being. According to Medical News Today, the average length of a depressive episode is 6 to 8 months. There are many different types of depression. Unipolar depression is the first one, and this is diagnosed when the predominant feature is a depressed mood. Bipolar depression, however, is characterized when you have depressive and manic episodes, which are separated by a period of normal mood. This is also called bipolar disorder. Major depressive disorder is depression accompanied by psychosis, which is false belief and detachment from reality, which can be related to hallucinations and delusions. Postpartum depression is what women get sometimes after going through labor. It's also called the baby blues. And the last one is seasonal affective disorder, or SAD. Its condition is related to the daylight of winter, so depression occurs during the winter and then lives for the rest of the year due to light therapy. There's 4 different causes of depression. The first is genetics. According to Healthline, it can be inherited. So if your parents suffer from depression, it's more likely that you're going to get depression than if you don't have any family members that had it. Biological is the second cause, and these people have noticeable changes in their brain. The neurotransmitters in their brain affect your feelings of happiness and pleasure, which is what causes the depression. Hormonal. Changes in hormone production or functioning could lead to depression. Menopause, childbirth, or thyroid problems could also help cause this depression. Psychological and social is the last cause, and this can occur as a result of prolonged exposure to countless negative events. It's said that people who live in a stressful work environment are more common to have depression than anyone else. There's a number of risk factors that come with depression. The first being life events, such as divorce, poverty, or any other major thing that can happen in your life. Personality, genetic factors, and childhood trauma are also risk factors. The abuse of alcohol or amphetamines can also be a risk factor. Major surgery or a post-head injury and chronic pain symptoms such as diabetes and cardiovascular disease are the last of these risk factors. There's a number of symptoms. These symptoms include depressed mood, reduced interest of or pleasure of something that you previously enjoyed, unintentional weight loss or a loss of appetite, insomnia, which is when you can't sleep, hypersomnia, which is when you sleep too much, fatigue or loss of energy, and feelings of worthlessness or guilt, worsened ability to think, concentrate, and react, and recurrent thoughts of death or suicide. The diagnosis for depression is very easy. All it takes is a simple checkup at the doctor. They can run tests to help diagnose your cancer or your depression. And the Hamilton Depression Rating Scale is one of the tests they can do, and it gives you a result that describes the severity of your depression. There are 3 types of treatment that are common. The first and most important is support. This can range from just discussing practical solutions with your family to just informing them. Psychotherapy is the second, which is talking therapies where you go to a therapist and talk about your problem, and drug treatment such as antidepressants. Most people go on to live happy and healthy lives if they go through treatment for depression, but going untreated, it can have lasting effects. In conclusion, I've explained to you what depression is and the many types of it, as well as the causes, the risk factors, the symptoms, the diagnosis, and the treatment for it. Now you can apply what I've informed you about in the instance of a friend, yourself, or a family member that may be suffering from the problem.